Hello everyone, my name is Kirsten Tingle, and today I will be discussing plantar fasciitis in golfers. The objectives of this video are to discuss the plantar fascia, to discuss the mechanism of injury or how you develop plantar fasciitis specifically in golfers, as well as discuss the treatment and rehabilitation for golfers or people that do recreational sports that are similar to golf. So first of all, let's identify the plantar fascia, and you can see down here, it's a ligament, so it connects bone to bone. And it runs all along the bottom of the foot from the calcaneus or the heel bone all the way up to those metatarsal joints or up here in the toes. And its job is to help support the arch, which you can see here. And it's flexible to a degree so that it can help with shock absorption and that force absorption every time you step. So what happens in plantar fasciitis is it's a chronic development. So it happens over time, where you're walking and stepping and maybe not stretching your feet or putting a lot of pressure down in one spot, and it causes inflammation due to stretching or due to overuse or due to that wear, as you can see here, of that bone, the calcaneus, into that ligament. And what it does is it causes inflammation or swelling, and it can cause pain, and it can also cause tearing in that ligament, which is not good at all. So the mechanism of injury can be due to your foot placement or the way that your ankle is oriented. So I pronate, which is not necessarily advantageous, compared to a neutral, which is straight up and down, or some people supinate, which is the opposite direction. Now you can see over here in this picture that this is the most frequent point of contact and the highest amount of pressure is put here in this force mapping down here on the foot. And you can also see in this photo that there are different locations that plantar fasciitis occurs, but most often it occurs right here by the calcaneus. Treatment for any kind of inflammation, this can be done with shin splints, it can be done with plantar fasciitis, anything that involves a ligament or a tendon near the bone. You're going to want to use RICE, which is that rest, ice, compression, and elevate. You can use massage to try to relax and get some blood flow back in there. You can use a foam ball or a roller or some other kind of ball to massage for yourself, so you can do it on your own time. Stretching is always important, especially if you're going to go use it for several hours, or walk around, or play golf. And taping and compression can also be really useful. So diving into the treatments, we again have that rest, ice, compression, and elevation. And this is going to be the first thing your doctor tells you to do when you come into the office and say, I have pain here, and they diagnose you with plantar fasciitis or inflammation in that ligament or tendon. It's going to include rest, and this picture says for 48 hours, but it can be as long as it takes or as long as you can stand to try to decrease some of that swelling. While you're resting, you want to ice, and it says 20 minutes at a time, 4 to 8 times a day. This just helps, again, to decrease that swelling and that inflammation and give a little more rest to that ligament or tendon. Compression also helps because it restricts the movement of that ligament or tendon so that it's not being stressed as much. And elevation helps to reorient that blood from the foot back to the heart so that it can be pumped back to the foot as new blood to help heal the injured area. Massage you can have done in a medical office as a massage therapist. You can have someone at home give you a nice foot massage. And this is where the point is to relieve tension, increase blood flow, and relieve pain. So this is a relaxation technique that's just kind of for yourself, or you can have somebody else do it. It's going to increase that blood flow, again, to increase that healing, but you don't want to overdo it because you can actually end up causing more pain. So a foam or ball rolling, there are many different ways you can do it. People can use a frozen water ball, as you see in the bottom picture. You can use a racket ball. They make some balls that have spikes on them. They're harder plastic, and they make rollers specifically for the feet as well, as you can see down here. The benefits of doing this type of treatment are that it's a self-technique, so you can decide your own pressure. It's not super time-consuming. You can carry a ball or a roller with you, and whenever you're sitting down, just kind of give yourself a nice little foot massage, or anytime you have time. And it's also something you can do while you're resting, while you're doing that resting period of the rice. Another treatment method is stretching. So you want to stretch the arch of the foot and the toes, as well as the muscles that are around the plantar fascia. So it's important to strengthen all the way down the kinetic chain. So we started with the hips, as you can see here, with hip extensions. Again, another hip exercise is side lying leg lifts. Here's this frozen pan roll, or the ball or foam roller. Towel stretching helps to pull those toes and pull them towards your head so that you're getting a stretch along the bottom of the foot. Stretching your calves is going to stretch the back of your leg, which may result in your calcaneus shifting a little. Seated plantar fascia stretch, again, specifically for the plantar fascia, where you can pull your toes outward just so you're getting a little bit of stretch, but you control the stretch. There's plantar fascia massage, which we talked about a little earlier, and an Achilles stretch, which again, your Achilles connects directly to your calcaneus. So tightness in that Achilles may be leading to tightness in that fascia, which would be causing the pain. Final treatment options, there are others, but taping is another one often used. Kinesiology tape, which is tape, has become very popular. You can see this method for taping. It helps to compress by restricting the movement in that fascia and restricting the stretch of the foot. Athletic taping, you can see over here in this one. And again, it's the same purpose as the K-tape, just a couple more pieces of tape. It's to relieve some of that pain by restricting the motion allowed by the foot and restricting the ability of that plantar fascia to stretch and wear against that calcaneus. You can also see down here there's a compression option. And these are socks. They're really easy to put on. Some people prefer these just because you can wear them around much easier and they're more comfortable than taping. But again, the idea is to restrict that movement in the plantar fascia so that you're not stretching and rubbing against the calcaneus or rubbing against another bone and causing inflammation and pain. So after you've gone through these treatment options and you've relieved a lot of your pain and the symptoms and the inflammation, you can begin to go into rehabilitation. And again, as always, it is important to remember that everybody's rehabilitation is going to be a little bit different because no two people or injuries are ever the same. However, the goals of rehabilitation are typically the same throughout all populations, and that is strengthening and preventing reoccurrence of injuries like this. So rehabilitation, the goals are to regain that full range of motion because we've been restricting it to decrease the pain. We want to restore foot arch muscle control, as well as restore normal calf and muscle control, and restoring normal foot biomechanics. These are all important in maintaining a normal gait and helping strengthening those muscles so that the plantar fascia doesn't have to work as hard to absorb as much force. So you can see over here in this photo, we have exercises like towel pickups where a patient will have their foot on top of a towel and they will scrunch their toes in order to bring the towel closer to them, and they'll spread it back out and repeat. Another exercise is a balance and reach, and this is to strengthen the ankle as well as the bottom of the foot. And you can see there are two variations of that. There are heel raises, which is going to strengthen that calcaneus, and your gastrocnemius, which is what the calcaneus leads into. It's that big muscle on the back of your calf. And this is going to help, again, with that absorption of force and hopefully decreasing the amount of work and stretch that the plantar fascia has to do. As always, it's important to strengthen up the kinetic chain, so we want to do some side-lying leg lifts, and there were other stretches and strengthening that we saw earlier in the video that would also apply at this point. As always in rehabilitation and therapy, it is important to remember that no two people are the same, so no two injuries are ever going to be the same, especially in a sport like golf, where you can have ages 10, 11, 12, in that middle school range, all the way up through senior citizens out there on the course. You may also have both genders, and sometimes the bodies of men and women are going to act differently, and so rehabilitation has to be modified based on that as well as with different weights and body shapes and sizes and orientations of joints. All of these things have to be taken into consideration when developing a rehabilitation plan for someone. Here's some of my resources if you want to check into some of those. Thank you for tuning in today, and I hope that you learned something from this video.